Hello, my name is Colleen Thompson, and today I will be discussing what nurse retention is and how low nurse retention rates affect hospitals. What is nurse retention? Nurse retention is using strategies in order to keep nurses in their field or on the specific floor they were hired on. These strategies can be customized to each hospital depending on the specific needs of that hospital and their staff. Why is it important? Keeping nurse retention rates up is very important because if the retention rates are high, then the quality of care will be improved for the patients. As a result, the patients will feel more comfortable in the environment and feel like they are welcomed. Nurses will not be overworked. When retention rates are low, nurses will have to take on more patients during their shift than they might be used to. Once they start to take care of more patients, they will run out of energy a lot faster. And lastly, hospitals will not be understaffed. This goes along with the last reason because if nurses are not leaving, the hospital will have more nurses to split up the number of patients to prevent nurses from being overworked. How do low retention rates affect hospitals? If a hospital has low retention rates, their staff will be overworked. Like previously mentioned, not having enough nurses causes the nurses to be overworked as the patient-to-nurse ratio increases. It will also be harder to hire more nurses once the retention rates become low. A perception will be in place that the hospital may not be good to work at if nurses seeking employment find out the retention rates are low. Once that perception is in place, nurses will base their opinions off of that. If nurses are leaving, then the staff that stays will be more likely to leave as well. This will most likely be due to them being overworked since there will be less nurses than needed to do the work. The quality of patient care will also decrease as a result because of this. If they are understaffed, the nurses will not have the same amount of time to spend on each patient as they used to. Why are retention rates so low? Nurses can often receive poor treatment from other staff members. This can include doctors and even their supervisors. If the communication is lacking between doctors and nurses, issues can often arise from this. Not enough education for new nurses can also affect how long they will stay in their job. New nurses that are coming out of college are feeling overwhelmed when going into their new jobs because they feel that they have not been given enough education to adequately complete their job. Low pay. This is not an easy fix because hospitals need to make money to pay their workers. They cannot control how much money they make, so it could be harder to give higher pay to nurses. Not enough positive feedback from supervisors. Nurses often feel that they do not receive enough feedback from supervisors as positive. Nurses normally only hear back from supervisors if they have done something wrong. Solutions to prevent low nurse retention rates. Have hospital staff take a survey to find their hospital's specific issues. The solution to this is not a one-size-fits-all plan. It will need to be customized to each hospital based off of what feedback they receive from their staff. Their survey would allow staff members to have input on the solution. Ensure the hospital is fully staffed. Ensuring the hospital stays fully staffed, if possible, can prevent nurses from being overworked, causing them to leave the field faster. This cannot always happen, but if it is possible, it would help out a lot. Talk with supervisors and other doctors to improve communication between the two disciplines. Improving communication can help with these issues that can often arise between doctors and nurses in the workplace. Provide opportunity for increased education within the hospital. By having educational opportunities, nurses that feel they do not receive enough education can take advantage of these classes. This can be for both new nurses and older nurses. These are my references. I hope you enjoyed my presentation.